Hello, it's Mrs. Straight Talking Orthodontist again. I'm going to talk a little bit more today about Invisalign attachments and basically explain what they're like for patients, what they look like, how they feel, and share some of the comments that I get from my own patients about Invisalign attachments. So what I've done first of all is if I turn around the camera, is I've got a picture here that I share with my own patients when we're talking through the setup. Just to kind of give people an idea of what attachments will look like on their teeth. And if you can see, I'm just going to zoom in a little bit here. There's a little outline of some bumps on the teeth here and there. You can maybe see a little bit on there, a little bit there. And if I move on to the next picture, you can see the same patient in slightly more close up. I've moved the lips back there with the photograph. So you can see there are a number of little lumps and bumps on several of the teeth here. And what's interesting is when you look from the side view, and then when you look, compared to the front view, you can see that some of these bigger attachments are actually become a lot less visible because they're now being looked up face on rather than in profile. And I think really it's when you look at these attachments in profile here and here, and here and here, that they are a lot more visible for patients. Now, what does that really mean for them in terms of kind of appearance, comfort, that kind of stuff? Obviously, when they first go on, they're going to be a little bit unusual to the lips and the cheeks. They might be a little bit irritating. And if I'm honest, there are a fair few of my patients who just find them quite uncomfortable. They find them a little bit rough, particularly when they've first been fitted. But normally when they're wearing their aligners, they don't notice them at all, and it doesn't really bother them. I know in some patients, my brother in particular, who had Invisalign, he kind of found them quite annoying, but in some ways he actually preferred them to be slightly annoying in a sort of a weird way, because it made him wear his aligners a lot because it was more comfortable than having the aligners out. So he got a really good wear time out of his aligners, but he just found it a little bit annoying when he took them out for eating and having cups of tea and things like that. Often patients who kind of are worried about the appearance of attachments, their level of anxiety about them often drops quite quickly, either just after they've been fitted. They say, oh, it wasn't as bad as I was expecting it to be. They're not as visible as I thought they were going to be. Because I think when you look at them on the setup on Invisalign, it looks it's very enhanced, the picture that you see. It's quite big. And also I think that it's a bit of a shock to the system as well. You can't really quite visualize what it's going to be like on your teeth. And obviously when I show them to patients, they're colored pink or purple just to make them visible. And in reality, as you saw on the pictures there, they're actually tooth colored, and so they're a lot less noticeable. I think personally, you as an individual having Invisalign, you'll be much more conscious of them, and you'll be kind of feeling like lots of people can see them. But in reality, I think they are actually largely very unnoticeable, even the slightly bigger attachments as well. In terms of the discomfort from the attachments on the lips, again, it's a bit like train track braces. It's uncomfortable because your mouth isn't used to them. But basically, once your mouth has kind of hardened up, if you like, they become kind of a secondary thing. You don't really, they go to the back of the mind, basically. You don't really kind of notice them. Having said that, nobody loves having attachments, and it's always a great day when we take attachments off for patients. They love having their own teeth back. But they do understand that they are necessary for treatment and to get the best outcome. So they put up with them because it's a small price to pay, if you like, to get a great result at the end. The other kind of thing that's quite interesting, I think, is that patients who often are quite nervous of the whole process of Invisalign and having to take them in and out, and the social aspects of doing that when they go out for dinner or things like that, they do often come back and say, do you know what, I can't be bothered with being discreet about them anymore, or I don't really care what people think. I just take them out, what the heck, which is quite interesting really, because often these patients are really nervous and reticent about having aligners and having attachments on, but they sort of almost, once their teeth start to improve and they can see the benefit, they just kind of become a bit more blasé about it, if you like, and then they find it they can cope fine. The other thing that happens is that you often get a lot of people interested in what you're doing, or you'll find that people say, oh, my sister's had Invisalign, or oh, I was thinking of having that done, that kind of thing. And often when you have orthodontic treatment as an adult, although it's quite difficult for us compared to our teenage counterparts because it's much more socially acceptable, I think it does often garner a lot of questions from other adults who may be thinking about it or were unaware that they could have braces. And so quite a few of my patients do kind of say, oh, such and such person said they'd had Invisalign, it's amazing, because I didn't really think that anybody else was having it done. And it's almost like they have a little club, if you like, of people who've been through the process. So I think although Invisalign attachments do sound a bit scary to patients and maybe put some of you off, I would say that it's actually probably not as bad as you initially think it is. I think certainly you can expect to get a few niggles when you first have any treatment done, because you've got to get used to the feel of these things in the mouth. But you very quickly do get used to it. And I think if you can persevere with them, it's well worth having Invisalign treatment if you're thinking about braces and you're really dead against having fixed braces. So I hope that helps you. We will keep posting as regularly as we can on the Facebook and YouTube pages, so keep tabs on that, and hopefully we'll keep putting some useful information up for you. And if you like any of our videos, please give us a thumbs up. Okay, have a good day and keep smiling, everyone. Bye.